Although for 35 years I've been involved in a general practice where we treat just about anything and everything in our clinic, in the last few years I began to focus more and more on arthritis. Naturally, since I do acupuncture, many arthritis patients have come through my door. Acupuncture has established itself as a wonderful method of pain control and has really been embraced by the American public. Like most practitioners, I was able to really help some people, and others didn't make any great gains beyond temporary pain relief. Not only did I have some bitter failures in that area, but I was one of them. The methods that the most famous practitioners and the most expensive textbooks recommended did not get rid of my arthritis and a lot of other people's. I was pretty frustrated. Oh, like a good practitioner of acupuncture, I analyzed my case and the internal conditions that were creating my arthritis, a situation that the Chinese call cold bee syndrome, wind, cold, damp, invasion, dysfunction of the yang motility vessel, and kidney energy deficiency. I did all the treatments designed to correct these funny-sounding conditions. Once I looked at it from a more Western perspective, though, it became evident that kidney energy deficiency was adrenal fatigue, which you can check with a simple lab test. You see, the ancient Chinese didn't know about the adrenal glands, so they ascribed all the adrenal functions to the kidneys. One of my beefs with how acupuncture is taught is that these terms are still used, regardless of whether they are accurate. Since we now know all about the adrenal glands, don't you think we should revise a few things? This is one of the reasons why many doctors are still slightly annoyed with acupuncture and Oriental medicine. Now, since I'm dual trained in both Oriental medicine and naturopathic medicine, I probably have a little more balanced perspective about these theories. Naturopathic doctors have been treating arthritis successfully for 100 years, so I certainly didn't ignore any of these methods either. What I found was pretty much the same thing. With a lot of natural therapies, people would get better, but were not cured. Some were, of course, but far fewer than I thought there should be. One would get better on a special diet, the next two would not. A good detoxification would totally get rid of someone's joint pain for a year or more. Trying it on a different person would not get as good results. And some people could not or would not follow the program. I got discouraged and decided there was probably no one method that worked for the majority of patients with arthritis. And if you don't have any idea in advance if what you're doing is going to be successful, then you don't feel very enthusiastic about it. So I went on treating sinusitis and allergies, migraines, indigestion, and injuries, things that I knew I could make patients feel better from quickly. Arthritis was like some embarrassing person you don't want showing up at your party. But because of my own problems, I never stopped searching. Since I knew a lot of naturopaths today don't use some methods that were popular a generation or two back, I thought maybe that's why you don't hear of the spectacular successes that I read about in the journals of the 1940s and 1950s. Fortunately, I had the opportunity to study with a number of older practitioners from that time period. And I adopted their methods, and I even inherited some of their equipment. I made a point to use anything and everything that showed some promise in arthritis cases. And I tested them all on myself. I took many herbal medicines that the botanical medicine literature indicated would be helpful for my joint inflammation. I soon realized that I was just using a natural version of an allopathic or conventional approach to try to shut off inflammation. I was just doing it with a plant instead of cortisone. I took a number of homeopathic medicines based on a complicated analysis of my history and symptoms, and here and there I thought something was really working, until the next flare-up came. I adjusted my diet, which wasn't too bad to start with. I eliminated food triggers that I had found, but sometimes I would hurt for no good reason. I explored counseling and psychotherapy, trying to eliminate mental or emotional factors that might have been contributing to my joint inflammation. I used all the physical modalities that we use here in the clinic. A fever cabinet to help with detoxification, various types of hydrotherapy, light therapy, ultrasound, ultraviolet, infrared, various types of electrotherapy, therapeutic exercise, massage, and of course acupuncture. One type of electrotherapy that was reported to be effective for arthritis back in the 1940s was the electrogalvanic bath. Although I found it was good for many things, many other things, it was disappointing in arthritis cases. Why? Why did doctors back then praise it, and yet I could not get the same results? Experts in physical medicine for decades have used hot wax treatments on arthritic hands and infrared lamps over stiffened joints, followed by passive stretching of the joints. Most patients, if you ask them, will tell you that it's useless and painful. Then there is short-wave diathermy, a treatment using radio waves. I've used this method for a number of different conditions in people over the years, but it never greatly benefited my arthritis. While many physical medicine texts recommend shortwave diathermy for rheumatoid arthritis, the facts began to be clear. Not only were people not getting better like they were supposed to, it was illogical that they ever would. Acute inflammation is characterized by heat, redness, congestion. These are the very effects that the treatment creates, just like infrared. And this is the last thing a hot joint needs. Diathermy is great for many conditions and is even useful in osteoarthritis, but rheumatoid arthritis, forget it. I was embarrassed that I ever used it. But many experts in conventional medicine and natural medicine also said it was useful. After I realized that diathermy was not only ineffective for rheumatoid arthritis but could aggravate it, I wondered how there ever could have been any success stories at all. I investigated pulsed magnetic field therapy, which uses waves like diathermy but produces no heat. Now this revealed a few of the factors involved with the people who got better from diathermy. They got better because of the frequency pulses of energy and the changes it made in the tissues, changes in pH, changes in the polarity of the tissue, changes in the absorption of nutrients, changes in how efficiently the body expelled waste matter from those same tissues. The ones who got better did so in spite of the heat and not because of it. Then I experienced a phenomenal treatment called Bowen therapy. I received so much benefit from it personally that I signed up for the training and became certified. It's a series of movements made with the fingers stretching and rolling the connective tissue and rolling it back over the muscles at various spots that I realized, as a trained acupuncturist, I realized that the spots were where there were clusters of very powerful acupuncture points. The Bowen movements create an impulse that the brain interprets as a signal to stimulate healing. It was through learning and using Bowen therapy that I realized why some of the therapies I had used did not work as well as I wanted. It was not the hydrotherapy, it was not the electrotherapy or the acupuncture, but the way in which I was doing them. Practitioners who got the best results were ones who, I found, took advantage of certain natural principles. They may have been taught them, or they may have been unaware that they were doing it. I think most of them were unaware. But it became clear to me that the principles that I learned from Bowen therapy applied to almost everything. So I changed the way I did acupuncture. For the most part, I stopped using needles. Instead, I use electrical stimulation, which works faster and is non-invasive, painless too. Using the appropriate rhythms and pacing and the right sequence of points on the body, I now get the results I always wanted in arthritis cases. Since developing my special protocol for arthritis, I've had uniformly good results, and it's easier on the patient. I mentioned that a lot of the methods that I used were developed a long time ago, but were then forgotten or passed over in favor of drug therapy. It might surprise you that part of my protocol was used in a major metropolitan hospital in the late 1940s and early 1950s. A medical doctor at Mount Sinai Hospital in New York performed thousands of treatments like the ones that I do, and finally wrote a book in 1951 called The Cure of Rheumatoid Arthritis by Physical Medicine. Now, you probably know that those in conventional medicine rarely use the word cure. This was a very brassy thing for an establishment doctor to do in the 50s. Nevertheless, he said in the foreword of his book, if one presents methods that cure flexion deformity of the joints in rheumatoid arthritis and influence favorably the systemic condition of the patient, and the results are uniform and last for years, then he is offering a cure for rheumatoid arthritis. That's a direct quote. Small wonder you can't find a copy of this book anywhere today. This doctor published the results of 30 years of his work, and like him, I find that it's effective in not only rheumatoid and osteoarthritis, but also gout, bursitis, lupus, fibromyalgia. We also have good results with the joint pain of Lyme disease. I wanted to give you a little of the background of how this protocol for arthritis and other conditions was developed. It isn't simply acupuncture for arthritis or herbs for arthritis, but a unique system that is safe, painless, and effective. I don't know of anyone else doing anything even like it. If you are in pain, please don't shy away from this treatment because it seems like something strange. Mount Sinai Hospital did 50,000 of these treatments yearly. And while they may not be doing them anymore, I certainly am. Thanks for watching.